This lidocaine patch is used to help reduce itching and pain from certain skin conditions such as scrapes, minor skin irritations, and insect bites. It can also be used to help relieve nerve pain after shingles. Lidocaine belongs to a class of drugs known as local anesthetics, and it works by causing a temporary loss of feeling in the area where you apply the patch. The recommended daily dosage and optimal timing for using this patch should be discussed with your healthcare provider. When using the over-the-counter product, make sure to carefully read and follow all directions on the product package before using this medication. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. This product should only be applied to normal intact skin. Do not apply to skin that is broken or irritated. The dosage is based on your medical condition and response to treatment. Remove the protective liner and apply the patch to the skin area that is most painful. Apply the prescribed number of patches as directed by your doctor, usually once a day. Depending on your product, the patch may be left on the skin for up to 8 or 12 hours. Follow the instructions carefully. Do not apply more than 3 patches once a day or leave any patch on for longer than the stated time period. If a smaller patch is needed, it may be cut with scissors before the liner is removed. It is best to avoid getting the patch wet since it may not stick to the skin. Some brands may be wet in water for a short time, such as showering for 10 minutes. Pat dry gently if you get the patch wet. After each application, make sure to wash your hands well. Avoid getting this medication in your eyes or mucous membranes, such as nose or mouth. If contact with the eyes accidentally occurs, wash your eyes right away with water and protect them until normal feeling returns. If your condition does not improve, or if it gets worse, or if you think you may have a serious medical problem, seek medical help right away. Used patches still contain some medication. However, do not reuse them. Fold the used patch with the sticky sides together and discard it out of the reach of children and pets to prevent accidental swallowing or application. If you experience redness, swelling, blisters, or changes in skin color after applying the patch, they should usually go away within a few minutes or hours. If these effects persist or worsen, contact your doctor or pharmacist. If you feel irritation or a burning sensation, remove the patch and wait until the irritation is gone before reapplying. Remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience blurred vision, changes in mental or mood, drowsiness, dizziness, or an unusually slow heartbeat. Seek medical help right away if you notice pale, bluish, or gray skin, unusual tiredness, shortness of breath, or a fast heartbeat. Although rare, a serious allergic reaction to this drug may occur. Seek medical help right away if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. In the U.S., call your doctor for medical advice about side effects or report them to the FDA. In Canada, call your doctor for medical advice or report side effects to Health Canada. Before using the Lidocaine HCl 4% topical patch, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as any inactive ingredients that could cause allergic reactions or other issues. It's also important to discuss your medical history, especially if you have liver disease or a certain blood disorder called methemoglobinemia. While wearing the patch, it's best to avoid exposing it to direct heat sources such as heating pads, electric blankets, heat lamps, saunas, hot tubs, heated waterbeds, or prolonged direct sunlight. This is because heat can cause more of the drug to be released into your body, increasing the chance of side effects. If you are scheduled to have an MRI test, be sure to inform the testing personnel that you are using this patch. Some patches may contain metals that can cause serious burns during an MRI. Ask your doctor whether you will need to remove your patch before the test and apply a new patch afterward, and how to do so properly. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. Similarly, if you are breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions when using Lidocaine HCl 4% topical patch. Interactions with other medications can affect how well the patch works and may increase the risk of side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products. Share this list with your doctor and pharmacist to ensure the safe use of Lidocaine HCl 4% topical patch. Do not make any changes to your medication regimen without consulting your doctor first. If this medication patch is chewed or swallowed, it can be harmful. If someone has taken too much, remove the patch if possible. If the person has serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, seizures, slowed breathing, and slow/fast/irregular heartbeat. Remember to always use this medication patch as directed by your healthcare provider and never exceed the recommended dosage. Make sure to keep up with your regular medical and lab appointments to ensure the effectiveness of Lidocaine HCl 4% topical patch. This will help monitor your progress and make any necessary adjustments to your treatment plan. If you use this Lidocaine HCl 4% topical patch regularly and happen to miss a dose, simply apply it as soon as you remember. However, if it's close to the time for your next dose, it's best to skip the missed one and apply the next dose at your usual time. It's important not to double the dose to make up for the missed one. Make sure to store the Lidocaine HCl 4% topical patch at room temperature. Keep the patch sealed in its protective envelope until you are ready to use it. And remember to keep all medications away from children and pets. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it according to the instructions in the How to Use section. Now, let's talk about the uses of Lidocaine HCl 4% topical patch. This medication is used to relieve nerve pain after shingles, infection with the herpes zoster virus. It is also used to treat pain caused by nerve damage in people with diabetes, diabetic neuropathy, and to relieve pain in certain skin conditions. The usual dosage for adults is to apply the patch to the affected area for up to 12 hours within a 24-hour period. The best time to apply the patch may be in the morning or as directed by your doctor. Be sure to follow the instructions carefully and talk to your doctor if you have any concerns. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.